Click on Tools and then Options. You need to check if you have a working HealthLink cert to do a lab order in HealthOne. Now click on HealthLink to make sure you have a HealthLink cert selected. Click on File and Print Setup to make sure you have a printer selected. Click on triple dot to select Printer. You can do the same to select Label Printer if required. Now select the patient you wish to do lab order on. When Patient opens, you must create a new transaction by clicking on this icon. You can select what transaction name you want under Name. There are two places you can create a lab order on System. In Medical Transaction, you can click on this icon and select HealthLink Lab Request, or you can click on Lab Request on left-hand side. Click on this icon to open Lab Order. Select HCP in drop-down. Select Hospital in drop-down. Your hospital may not appear on this demo, but will be available when it goes live. Click Create New Patient if not found. This now loads the HealthLink Lab order window. Here is GP out of hours number. This will autofill once that number has been stored within the system. Here, you must enter clinical details for patient. It must be more than 5 characters. There is a link just under clinical details called Lab Order Guidelines here, if more information is required. Now you can see Date Specimen Collected and Time Specimen Collected and its priority. These are editable. Now select the labs you require for patient. There are 3 pages of orders you can select from if required. Some labs may require you to select extra information when adding an order. For example, in this Indian rupee, you must select an oral anticoagulant. In this case, we select warfarin. There is an option to select antibiotic therapies, but these are only filled electronically for microbiology orders. When happy with selection, click Review. If you wish to amend what you have added, click Amend Tests. You can remove labs as well as adding more. It is very important you do this before hitting Commit Order. If happy with order, then click Commit Order. A window will now appear showing what specimens are required for Bloods bag. It also shows how many specimens are required. Now you will see the lab order request you can print by selecting Print. When you close the lab order window, you can see the lab request in the transaction on the patient's chart. This icon will show a green tick when acknowledgement message has been downloaded. If you wish to print the lab request again, you can do this by double-clicking on top item and selecting Print. Now to show how to create a favourite in lab orders. Open Patient. Insert a transaction with today's date. Select this icon and choose HealthLink Lab Request. Select Hospital and create New Patient again to open Lab Order form. To create a favourite, click on Manage Favourites. Click on Create New List. Give your favourite a name by clicking on Favourite List Alias and click Next when done. Select labs you require. There are 3 pages of orders you can select from by clicking Priority 1, Priority 2 or Priority 3. If you are happy with selection, click on Review and on Next screen, click Save Favourite. You can have a maximum of 15 requests on one order. Again, you must enter clinical details to continue. Select a lab order favourite. If you wish to amend what has been selected, you must do before clicking Commit Order. If happy, click on Commit Order. Now you will see windows showing what samples and how many samples are required. Click Print to print off the order.